Welcome to the press briefing. With us today, we have Dr. Chang Chok Kwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Gladys Guan, Chief Manager from Hospital Authority. The two doctors will give us an update with the HA and also the epidemic. Dr. Kwan, good afternoon. We have 1,425 patients hospitalized. Among them, 175 are newly confirmed patients. Those who require isolation facilities, 456 of them are in isolation wards, 339 in second-tier isolation wards, 428 in ICC of North Lantau Hospital. Among them, 132 are newly confirmed patients. Yesterday, 4 cases of critical condition were reported, 5 serious. For those hospitalized and confirmed, there are 31 in critical condition, 17 in serious condition. 7 of them are in ICU. 6 new cases of death were reported yesterday, 3 male, 3 female, aged between 84 and 97. They were not from care homes. 2 had 3 shots, 3 had 2 shots of vaccines, 1 no vaccination record. The first was reported to us by the forensic department of the Department of Health, an 84-year-old female who has suffered stroke and dementia and heart disease. On the 18th of July, she was found unconscious at home, and she was pronounced dead on arrival to A&E department. The case has been referred to the coroner's court. Subsequent investigation found that she was PCR positive. Another case was a 88-year-old female with 3 shots of vaccines with no underlying diseases. On the 11th of July, she started to have upper respiratory tract symptoms, and she was RAT positive on the 12th. At a designated clinic, she was given oral antiviral medication. On the 17th, she had shortness of breath. She fainted on the street and passed away at the A&E department. The 4 remaining patients passed away when hospitalized. The first is a 97-year-old male with hypertension, diabetes, and high cholesterol. On the 15th of July, because he was rather weak and with fever and coughs, and he attended an A&E department. At the A&E department, he was RAT positive, and the PCR value was 17.6. He was hospitalized to the medical unit and then started antiviral medication, and he required high level of oxygen and passed away yesterday. We've also got a case of 94-year-old female with high cholesterol, high blood pressure, and high sugar level. On the 19th of July, she had fever and URT symptoms. At the A&E department, she was confirmed and hospitalized to a medical ward, and she started antiviral medicine, but she passed away yesterday. We've also got an 87-year-old male with 2 shots of vaccine, suffering from diabetes and requiring renal dialysis because of renal failure, high blood fat, and also he had suffered stroke in the past. On the 7th of July, he was PCR positive, and then he was admitted to the medical ward and given oral antiviral drug. His condition deteriorated and passed away yesterday. The last case of death is an 85-year-old male with 2 shots of vaccines. He has got renal failure and require renal dialysis. On the 11th of July, he felt dizzy and unwell at the A&E department. His PCR result was positive and he was admitted. But then, because of bacterial infection, he passed away yesterday. In the Yesterday, 153 patients recovered. Among them, 130 were discharged. 4 patients were found positive through admission screening or while in hospital. 4 patients in the same ward or staff were classified as close contacts. We have a total of 2,727 staff members confirmed. 25,166 staff members have returned to their posts. And prescription of a new COVID-19 medication. Now, in different facilities, public hospitals, isolation facilities, care homes, and holding centers and community isolation facilities, we have prescribed 2 types of COVID-19 medication. As at the 24th of July, we have already prescribed 238,000 doses, 21,000 model fever, and 17,000 Pavlozod. We have got sufficient medication in store for patients, so we will prescribe antiviral drugs to patients where appropriate to lower the risks. So may I appeal to the public, while most confirmed patients have mild and stable symptoms, please do not let down your guard. And for the elderly, those who are immunocompromised and with underlying diseases, because COVID-19 conditions can deteriorate very rapidly, so patients have to come to us before they can be prescribed with the right medication. And those who are confirmed can seek help at our 7 designated clinics. And those isolated at home, they can call our hotline 1-836-115. Our colleagues will identify the right patients, and they can use our HA Go app and receive medical consultations. And after that, we will deliver drugs to their place. Private GPs and private hospitals can also prescribe COVID-19 drugs. So those who have yet to be vaccinated or fully vaccinated, please do so to avoid the risk of serious symptoms or death. Dr. Zhang, we had 3,175 positive cases, 1,595 confirmed by RCT, and 2,350 confirmed, 80 confirmed by RAT. We have 301 imported cases, 293 by PCR, and 19 by RAT. Said by Dr. Kwan, we had 9 cases of death yesterday. In the 5th wave, we have a total of 9,265 deaths. For the 301 imported cases, 182 were picked up at the airport. 92 at quarantine hotels. 27 cases have already left quarantine hotels. These 301 cases came from 41 places. The remaining 8 places have imported over 10 cases, and they are 66 from the UK, 35 from the US, 28 from Thailand, 25 from Singapore, 18 from Australia, 16 from the Philippines, 11 from South Korea. For the remaining 33 cases, they are from places with 10 or less cases. For care homes, we have Hong Kong Spastic Association Seng Hong Yuan, a residential care home for the disabled. 1 resident plus 1 employee are confirmed respectively, and 16 close contacts have to be quarantined. Today is Tuesday. 387 schools have reported 524 positive cases to us. 447 students and 77 staff members. In the past week, 243 schools have reported 2 cases or more to us. Today, we've got 11 schools with classes suspension.
These include The Ching Chung Haupo Woon Secondary School, Class 2M, with 3 infected students, altogether 28 students in the class, and Sai Duck Kindergarten in Yuen Long, that's a Class K2B with 24 students, with 3 accumulated cases.善一堂安日Kindergarten in Kwun Tong, whole day Class B, 18 students with 2 infections. Man Sang College in Kowloon Sing with a Class 5A, 30 classmates with 5 infections. Chinese, the CCC Ying K College, Class 3C with 33 students with 5 infections. 香海正覺園社 Buddhist Pogong School in the North District, Class 4C, that's a special school. There is 1 infection. In Class 4C, there are 3 students. The 2 other students can continue the lesson. In Yuen Long, Deng Gi Yip Primary School, Class 4A, 20 students with 3 infections and 1 week suspension. The kindergarten, Class A, AM class, there were 2 infections yesterday, including a teacher, and today there are 2 more. And another secondary school, Class 3A, 32 classmates with 4 infections. 聖文德天主教 primary school, Catholic primary school, Class 5BS with 3 infections. In the class, there are 30 students, and also Class 6BR, 21 students with 3 infections. 金巴倫長老會耀道 Secondary School, Class 3A, 26 students with 4 infected students, 1 week suspension. And the last one is香港靈糧堂 Kindergarten, 秀德 Kindergarten, AN class, that's a nursery class, 19 students with 2 infections. 1 week of suspension is required. Concerning the mutant strain, we are monitoring the trend. So far, for suspected BA.2.12.1 cases, they account for 3% of the total number of infection, a mild increase. Suspected BA.5 or 0.4, the percentage is 1.8%. That's all for my report today. Thank you. Now we will take questions. Please raise your hands and ask questions using our microphones. And please identify your media organization before you speak. The first one, the lady in the right.
From Bloomberg News. My question is about the approval of vaccines for children under 3 years old in Hong Kong. Singapore just announced today that they will look at vaccinating children between the ages of 6 months to 4 or 5 years old with either the Pfizer-BioNTech or the Moderna vaccine. Has there been any updates on the approval of the BioNTech children's vaccine? Thank you.
I have not noticed any updates on this aspect.
Next question. Any more questions? The lady on the left. Good afternoon, doctors. I'm from Now TV. An expert says that we don't need to update the new infection number daily. So what do you think? So at what stage will you stop announcing new daily numbers? And also, there are suggestions that you should engage experts to give you advice on the trend of the epidemic. So what do you think? With more and more infections, does quarantine facilities like the Penny Bay need to be reopened? Well, I think different experts have different views. The government will take into account the different views before taking actions. Concerning Penny's Bay, we will continue to monitor the trend of the epidemic. At present, we are monitoring the utilization rates of the facilities every day. If the situation gets more serious, we will continue to discuss with the governments about the steps to be taken. The lady in the second row, I'm from News. So recently we have had more cases reported by schools, and many schools have been in suspension because of infection. So what is the reason? Do we have major outbreaks in schools? And is there any precautions that we can take? The increase in the number of infections in schools are in line with the increase of cases in the community. So when there are more cases in the community, and there will be more cases in schools. Every day we require teachers and students to undergo a RAT test daily. In certain classes, there are 2 or 3 students infected. It may be due to clustering, so we have required those classes to suspend teaching. But luckily, we don't see any major outbreak yet. The lady in the back. Good afternoon. I'm from Mingpao Daily. A question for the HA. You mentioned the 84-year-old female who passed away after having a stroke. So what was her vaccination status? Did she not seek help from designated clinic? And also for the CHP, do we have no new cases from the Kowloon YN College? And what about the hobby classes in the school? Were the 2 hobby classes instructed by teachers in school, and are the teachers staying at home? And also, some experts suggested that students, before taking the daily RAT test, before engaging in without mask activities, they should take another RAT. So would that affect the arrangements for students participating in hobby classes? Concerning the 84-year-old deceased patient, according to our record, she was not vaccinated. Concerning her symptoms and whether she had sought medical help, I don't have any information. Now, the Kowloon YN College, there is no new case today, and other students have been staying at home since then. Well, I'm not sure whether all the hobby class teachers are teachers from the school. Anyway, they are suspended. Concerning the daily RAT and RAT before activities, that would be a good practice. The lady in the second row. Good afternoon, Cable News. About the Kowloon YN College cases. 4 students participated in the volleyball class, and another 15 students are in the middle and senior choir. So, are there any? Are they related? So you said there is no major outbreak. So do you think there is a risk which would require a territory-wide suspension of schools? Later on, we will have the red, yellow, and green codes. It may affect the number of days required for visitors to undergo quarantine. So would they increase the number of imported cases and overload our healthcare system? Because we have had quite a number of imported cases daily. And what do you think the pace of relaxation to be? About the deceased female patient, 88-year-old with 3 doses. On the 17th, she had a shortness of breath and fainted. So did she pass away yesterday? And the 85-year-old male deceased patient, was the cause of death bacterial infection rather than COVID? Concerning the Kowloon YN College, there is no update. Now, the volleyball class and the singing class have been suspended. So there is no infection in other classes except for class 5Y. So of course, we hope that the daily RAT would prevent an outbreak in schools. The government's principle is to achieve the maximized results with the while minimizing the resources, and we have to be accurate, and we will follow these principles. The 88-year-old deceased female, she passed away on the 17th of July. She fainted on the street, and when she was rushed to the ER, she was dead already. For the 85-year-old deceased male, he developed symptoms on the 17th of July. He was given treatment all along. In the end, because of an infection, we were able to develop a culture from her tummy fluid, so that's why he passed away.
We at home due to COVID. So how worrying is this situation? And also, the case numbers have been wandering around 4,000. So is there a need to open more isolation facilities? Thank you.
Maybe I will say a few words before. We know that there are quite a number of elderlies who are staying at home and has been fatal cases. And we know that quite a significant proportion of them have not received any vaccinations. So I would like to take this opportunity to urge elderlies and their families and their friends to bring them for vaccination as soon as possible, because vaccinated is the most important way to prevent severe illness and death.
And about the elderly, so we urge them not to overlook their symptoms, because most of the time they are asymptomatic or they think their condition is quite stable. But as just mentioned, their situation or their condition can deteriorate quite rapidly. So just as mentioned before, we have various channels for these patients to seek help. Apart from the what we have already have the telephone hotline, which is 1-836-115. We also will ask our colleagues to identify those patients who are at risk, and we will contact them proactively, and we will introduce our telemedicine, so that we hope that through all these channels, this patient can reach to us, because with these opportunities, we can then prescribe them with the medication. Of course, the same as the vaccination is also very important to them. And I echo what Dr. Zhang has mentioned. For those who haven't received the vaccination, they should seek the opportunities to finish the vaccination as soon as possible. And for the opening of the isolation facilities, we will keep a close view of the current situation. And if there is any further increase in the number, there's a possible of chances to increase more. So we'll keep in view of the current situation and work with the government.
One last question, the gentleman on the left. Good afternoon, I'm from TVB. We can see that in the past month, the number of confirmed cases has been on a rising trend. Do you anticipate that the number of cases is not going to go down before the summer vacation? Do you think we need to tighten social distancing measures to prevent the spread of the disease in the community? For the oral antiviral medicine, while such medication has been prescribed to the elderly, it seems that the situation is far from desirable, and some of them have passed away nonetheless. So do you have new ways, and are these drugs really useful in preventing critical cases or even death? And recently, we have cases that are confirmed and isolated at home who passed away. I'd like to ask whether CHP has new measures or preventive measures to prevent this from happening. Any advice to the public, please? The number of confirmed cases can be seen to be rising gradually. And the effective reproduction rate, according to Hong Kong University, is over 1, is about 1.3. And so it's about 1.2. And we haven't seen any sign of decline. Because if there is, then R will be close to 1 or even lower than 1, but it is yet to reach this stage. I know that the government Now, because I've been fighting COVID for a long time, and the government doesn't want to tighten social distancing measures lightly. But of course, we are not in a position to relax further. So we appeal to the public to be cooperative. If you feel unwell, you should see a doctor as soon as possible. For those who have yet to be vaccinated, do so as soon as possible. And for elders, they are high-risk persons. If they haven't been vaccinated yet, then please help to make them do so ASAP. Some elderly persons might have been tested at home, but they have not declared the situation or call us. I hope they can make use of our facilities. They might be RAT positive, and family members will need to help them to declare to us. Failing that, information cannot be forwarded to the hospital authority for prescription of medication. If they don't know how to declare online, they can use the hotline 1-833-6115. And if they are tested positive, then they can call 1-833-6115 as said by Dr. Kwang, and then we'll see whether telemedicine consultation can be arranged. Hopefully, they can start taking medication as soon as possible to prevent their condition from deteriorating. Most of these elders are high-risk chronic patients, and as said by Dr. Zhang, when they have symptoms, they should seek medical consultation as soon as possible. The earlier they see a doctor, the earlier they can be prescribed medication. And of course, we want them to be vaccinated, because in the unfortunate event that they're infected, if they are vaccinated, then the risk of a serious condition or death can be prevented. Thank you.